Dr. Stacey Richards. I'm a naturopathic doctor, health detective, health guru. I've been doing this for a few years now, probably over a decade. It's been a while. I love what I do. There's nothing more fulfilling than seeing my patients do well after just some small changes. Every time I have a patient in my office, I always try to determine what their stress levels are, because I find it's a really important part of their health. So I will often ask, give me a rating 1 out of 10 where you'd put your stress levels, or what's the most stressful part of your day. And every now and then there's always a patient that says, oh, I'm not stressed. I never get bogged down with stress. Yet everything about them screams, I am so stressed. The truth of the matter is we all get stressed. It's just a matter of how we cope with it, and we each cope differently. And when we get stressed, your body invokes what we call a stress response. And sometimes it's so subtle you may not even be aware of it. And that's a way to help you cope and manage that stressor. So what happens is, in terms of stress response, is your blood pressure will go up, your adrenaline level increases, your cortisol hormone goes up, and blood flow sort of leaves the extremities of the body. Our job is to make sure the stress is more manageable and more short-lived. So you know that friend you have called Freak Out Freddy who's stressed out about everything, and you're almost afraid to ask him about his day because you know it will be a heightened story of an extreme stress response. And then you have your friend who's so calm and nothing seems to faze her. Let's call her Calm Kaylee. And she seems to handle stress very well. So they both have stressors. It's just that they both have different coping skills. Kaylee seems to have better coping skills or short-lived stress responses, whereas Freak Out Freddy seems to prolong the experience and have continued stressors and probably never get to a calm or relaxed state. So when you're in that state where you never get to the relaxed state and you're constantly in stress, you do have some hidden costs of what that stress does to your body. Most times I see it in terms of sleep disturbances, weight gain, PMS, mood changes like anxiety and depression, cognitive behavior functions, so people have difficulty focus and concentration, thyroid issues. And so these are all symptoms of a larger picture, bigger, or something else that's going on. So I often dig to find out what that stressor is. So your next question would be, how do I get out of that? So as a health practitioner, what I often do is I use nutrition or herbal medicine to sort of help my patients get from a stress response to a relaxation response. There's also lots of lifestyle changes that you can invoke to have that happen as well. So yoga, meditation, exercise, reading a book, going for a walk, whatever works best for you is what's going to work to bring that response, to bring that calming or relaxation response back. The truth of the matter though, we all may not get to the calm Kelly state, but the ultimate goal is to have better coping skills so we can get to that relaxation state faster. Long-term illnesses are related to acute stress. There are several long-term illnesses related to acute stresses, and that's because when you're under acute stress, your hormone levels changes. You're pumping out more cortisol and other hormones that really affect your long-term stresses, so that really affect your body. So what happens is those hormones are supposed to stay at an even keel level they're normally supposed to stay at an even keel level, but when you go under stress, all of a sudden you have them heightened, and that can cause, for example, weight gain. Is a common thing that I see with acute stress. Also sleep issues, because now your cortisol that's supposed to be low to help you to sleep is now high, and it's always high. You have a problem with sleep. Diabetes is another long-term issue that I see with stressors, because now again that hormone is constantly being released and it's not going down. Does stress affect heart disease? Absolutely. Heart disease is multifaceted, and there are many reasons why people have heart disease, but stress can definitely push you in that direction. It causes you to have a stroke. It clogs the arteries and damages your blood vessels, and that's why a lot of people who have high stress can sometimes have some heart problems or heart disease. I'd like to talk to you a little bit about burnout or chronic fatigue. And so a lot of people these days experience burnout, whether I see it commonly in people who are go. They're always going, there's never any downtime, their mind's always going, they're usually type A personality. And so what happens is the adrenal gland that sits on top of the kidneys that help you cope and manage stress just gets going, and there's never any downtime. You never really get to that relaxation state that we talked about. So you're constantly pumping out cortisol, and after a while it can do no more, and you start getting really tired, extremely tired. Your sleep is affected, your mood is affected, and you just don't have the energy anymore to go. And remember, cortisol was that energy hormone, so now you no longer have enough, so your energy is done. And that's what causes energy burnout. There's no more to go. What's adrenal fatigue? That's one of those words that has been around for many years, and I think it's recently been getting some sort of recognition. A lot of times doctors don't know what to do with it. You come in to see your doctor, you're tired, you're feeling burnt out, you're fatigued, and you have all sorts of problems like sleep problems, GI problems, hormonal problems, PMS, menopause, and you have increased menopause symptoms that you just can't go away. And so you're always wondering what's going on. The doctor doesn't know what to do with you. And that is what I find is adrenal fatigue. Stress. Herbal medicine I love because it's one of the fastest and best way I find of getting people's reaction and response that much better. But a lot of times I also like to start with sort of nutrition. Nutrition is also very key and pivotal in terms of how your body responds. It's nothing worse than sugar and caffeine for your stress levels and anxiety levels. So certain things we want to sort of cut out completely as we move forward, because no matter what you take, it will still be difficult for you if you're still not sort of eating something that's going to be promoting more stress and anxiety and more sort of acute feelings of stress. So yeah, herbal medicine I find is really important. Rhodiola especially is fantastic for stress management. There's also, and if stress comes with the extra component of depression, then there's also other herbs that you can add in, like St. John's wort, for example.